Okay, get it? I'm Jane, and you can call my last name Gorbet or Gorbet, whatever one you want. And I am from Planned Parenthood and have been doing this for maybe 12 years. And she gets me free, so I always get to do a commercial for Planned Parenthood. And if you're already a patient here, I'm not going to say, oh, how's your infection? I won't give anything away if I see you. On Tuesdays and Thursdays, we have walk-in clinics. So after 12:30, so if you need to, just come on and walk down. We've expanded our hours. We're open till 8 o'clock every night and 2 Saturdays a month. So everybody should be able to come down at some point. And we are your one-stop shopping for reproductive health care. We do STI checks. We do abortions. We do sterilizations, male and female. We do testing for abnormal paps and treatment for abnormal paps. And we do a lot of education. And once in a while I get to come out in the community, and this is my swan song. This is my last time. So I really will miss it. Not the coming out in the rain in the evening, but your class especially. Okay, so she wants me to go over anatomy and physiology and birth control methods. And if you have any questions, please feel free to ask me, because I can't read your mind. And that's my job, is to answer questions. So if you don't have questions, I don't have a job. So please do. And I know a lot of this stuff that I'm going to tell you about today really is on your next exam. Should I give them the clue? Okay. If I go like this, that means I think it's on your next exam, and you better take a note. Okay? If you're studying for the test and you don't remember what I said, please feel free to call me. I'll be happy to go over anything with you on the phone or in person. Okay? So most of our services at Planned Parenthood would be free or a $5 copay. That's for the women. For men, if you really don't have any money, we have special funds. We can help you. So don't stay away because you think you can't afford it. Okay? So I hope to see some of you down there. All right. So I am going to go over anatomy. So here's this old uterus that looks probably like what mine does if I still had a uterus. This old picture which I'm going to retire. Okay, so just so that we're all talking about the same thing, this is the vagina. Thank you for smiling. Everybody's just so serious. Okay, and see these little ridges here? That's what feels good to the penis. The vagina has ridges, like, what, those Lay's potato chips? This is the cervix. This is the opening to the uterus. Sometimes I get bumps during intercourse. Have any of you ever had that bumped, or for men, have you ever felt that? Now I'm going to be talking about heterosexual sex today because we're talking about birth control. But that's not to say that I'm not aware that there's other kinds of sexual orientation. But we will be talking about heterosexual sex. Okay, so has anybody ever felt that? If you have, that means that probably you're not turned on enough. Because when a woman is aroused, the whole uterus pulls up, gets out of the way for the penis. Anyway, that's a whole other class. This is the uterus. It's the size of a woman's fist, and the opening is the size of a thumbnail. The tubes, these are fallopian tubes. Remember this from 6th grade, and the boys went in one room and the girls went in the other room because you didn't want to talk about it, right, together. All right, so these are the fallopian tubes. They're about the size of a spaghetti, and the inside is about the size of 2 hairs. So the inside of the tube is pretty small. And it has this little finger-like things here, and they're always going like this. They're going, come on, come on, come on, come on. So as you women are sitting here, you've got this going all the time, coming, come on, okay? And inside the tubes, you have these little hairs that move like this, and there's liquid in the tubes, and so that liquid on the hair goes like this, like a whole conveyor belt. So you've got this little conveyor belt action as you're sitting there. You thought you were just sitting there, but a lot of stuff is going on as you're sitting there. Okay, these are the ovaries. They're about the size of an unshelled almond, and they contain the eggs. And a woman is born with all the eggs she's going to have. She doesn't suddenly, you know, she's 13, ooh, she gets these eggs. No, they're just in there, they're quiet until she goes through adolescence, and then they start getting real active. Now, the eggs are about the size of a grain of sand. Okay? And this is the lining of the uterus here. So everything is a little bit smaller than what most people think of, especially if a woman has cramps. She thinks she's dragging around a whole big bunch of machinery. It's actually much smaller. Okay, now the vagina is an actual organ in a woman's body. It's not just a space or a hole. It's as legitimate an organ as the liver or the spleen or the heart. And the uterus is the strongest muscle in a woman's body. And in fact, a man does not have a muscle that's as strong as the uterus. So you can work out all you want, guys. We still have this very strong muscle. Okay. Oh, I've got something. Let's see how you do with this. Okay, any math majors out there? No? Anybody know how to read this numeral? Give it a shot. Try. Make a mistake in this class. It's okay, right?
Trillion, isn't it? 760 trillion.
760 trillion, right. What do you think that is? 760 trillion what?
Eggs.
No, but that's a good answer. 760 pounds? Oh boy, that would be somebody really big, wouldn't it? No. Think about what we're talking about today. Sperm, right. Someone who dares to say sperm. Very good, yes. 760 trillion sperm. What's it relate to? 760 trillion sperm. What? Somebody say something?
Trillion sperm cells?
Cells.
Lost.
In a man's body?
In a man's body. Close.
Or come out during ejaculation.
That's close. Very close. You're never going to get it, so I'm going to tell you anyway. 760 trillion is the amount, you ready for this? It's the amount of sperm ejaculated worldwide per second. And somebody probably got a grant to study that. But the reason why I put this up here is just so that you're aware that there are millions and millions and millions and millions of sperm out there. So if you don't want to get pregnant or cause a pregnancy, you need to be careful. Okay. So what kinds of questions do you have about this? What things are? Everything's okay on that? All right. So let's say it's Saturday night. The couple's having intercourse. They're just having a good time, but the body wants the woman to become pregnant. Mother Nature wants this woman to become pregnant. She may not want to, but that's what the body wants to do. Okay, so the man puts the penis in the vagina, and it feels good. The vagina is a good place for the penis. And the man ejaculates, and he ejaculates millions and millions and millions of sperm. Why so many sperm? Is it because that's just like a guy to be messy and overdo it? Huh? Any guesses?
A lot of them aren't strong enough and they die.
Okay, a lot of them, it's a dangerous journey going all the way up here, and there are no signs that say cervix this way, Goleta this way. Okay, so some of them get lost. They get lost in the folds of the vagina. Okay, some of them are really going the wrong way, and most of the time there's a big plug of mucus around the cervix. Yes, we are going to talk about mucus. It's a plug of mucus around the cervix that protects the uterus and the tubes from infection. So most of the time sperm just go up here and they bump their little heads right on here and they can't get through. If sperm have to stay in the vagina, they die because the vagina is acid. So sperm cannot live in the vagina. But the main reason why there's so many millions and millions of sperm is that the head of the sperm has an enzyme on it, a chemical that lets the head of the sperm attack the shell of the egg and soften it so that one sperm can slip in. So that's why you need so many millions and millions and millions of sperm, is that it needs the combined efforts of all of those sperm with the enzyme on it to soften the shell of the egg so one sperm can slip in. Okay? So it's Saturday night, they're having intercourse. Most of the time, this mucus is thick, right? Sperm cannot get through it. But when a woman is fertile, this mucus is going to change. And it's going to change from this thick plug of mucus to a kind of mucus that's actually going to help the sperm move up. Now, sperm have to get up to the safety of the crypts. Remember what this is? Okay. Now, crypts are just little places in the cervix that sperm get to hang out in. Now, remember, the vagina is acid. Sperm can't live in the acid. So they need to get up into the safety of the crypts. Now, the crypts also have a gland in them that produces the mucus that we're going to be talking about. Yes?
Repeat that.
Which part?
Can you just start over with safety of crypts? There are little places in the...
Okay. These crypts are little places in the cervix where sperm hang out. Thank you for asking. And it has a gland in it that produces the mucus that we'll be talking about. Oh, she tells me that's going to probably be on your one, on the next one. Okay, I did do this about crypts, if you didn't see that. Okay, so sperm, when the woman's fertile, the mucus changes, sperm go up into the crypts, and they can stay in the safety of the crypts for 3 to 5 days. Okay, so sperm can stay here for 3 to 5 days. And during that 3 to 5 days, they're time released up into the fallopian tube. So what that means for you, what's today? Thursday? You could have had intercourse on Sunday and be getting pregnant right now as we speak. I see some nervous, worried faces. Yes. Okay. So sperm can live there for a long time. So the sperm are here. They're being let go into the tubes. Meanwhile, 20 to 100 eggs are ripening. They're very obedient. They already know. So every month, 20 to 100 eggs start to ripen. Yes? In the ovaries. Thank you. Every month, 20 to 100 eggs start to ripen in the ovaries. And then one says, oh, I want to go. I want to get out of here. I want to go. And they start getting bigger and bigger. And right away, some of them die. Others continue to grow and get bigger and bigger and riper. And then part of them die. Until finally, the woman just has one great, big, huge, ripe egg saying, I want to get out of here. I want to go. So we get this great, big, huge egg here. Okay, ready. You've got this tube going, come on, come on, come on, come on. And now we know that if a woman has had, well, let me tell you this. When the fallopian tube knows that the egg is ready, the tube moves over to the ovary and actually sucks up the egg. So and then the egg leaves the ovary and goes into the fallopian tube. So what is that called? Remember from 6th grade, what is that called when the egg leaves the ovary and goes into the tube? You know this. Ovulation. Okay. So ovulation is when the egg leaves the ovary and goes into the tube. And that just takes, a minute or so. It's a very small amount of time. Okay, so we've got the egg in here, and it's got the conveyor belt. Now, sometimes there's a second ovulation. Sometimes a woman will release a second egg. If that happens, that will always happen within 24 hours of the first ovulation. But that's what good stories come from. I want to suggest this storyline for all my children because, get this, it's been documented that a woman ovulated one day, had intercourse with a man of one race, and got pregnant. Ovulated the next day, had intercourse with a man of another race, and got pregnant. And she had twins that were very different. So that can happen. Have you heard any of that storyline on any soap operas? No? I think this would be good. I'm going to email him. Okay. So that's how non-identical twins are formed. It's 2 eggs, 2 different sperm. What about identical twins? How are they formed? Right. The fertilized egg splits in 2, and that's why you have identical twins. Okay, so let's say there wasn't another ovulation. So we got an egg right here, goes to right here, and it kind of stops. Sperm are going up to the tube, and then the sperm attack the shell of the egg with that enzyme, soften the shell of the egg, and one sperm slips in to the egg. Now that happens in the tube. And what do we call that? When the sperm enters the egg?
Fertilization.
Thank you. Fertilization. Now fertilization occurs in the tube. Some people are kind of confused about that, think some random place in the body. But it does occur in the tube. Then it starts to grow and divide and grow and divide. Do you remember cytosis, mitosis in high school? You heard that? Grow and divide. Continues its journey until it gets into the uterus. And then it bounces back and forth for a little bit. But something we've found out now, something that's new information, is that the fertilized egg, the inside of the fertilized egg has an enzyme that lets the fertilized egg crack out of the shell. And women who are older, women over 35, a lot of them stop producing that enzyme. So that's one of the reasons why some women who have delayed having their children are finding that they cannot conceive because they stop producing that enzyme. They have the egg, they have the sperm, the tubes are clear, but the egg cannot get out of the shell. So this is a young woman, the egg cracks out of the shell, it hatches, and then that has another enzyme that lets it burrow into the lining of the uterus. And if all goes well, what happens in 9 months? A baby. Okay. What happens to this lining? This lining has built up and getting rich and thick and succulent, putting little mints out, hoping for a fertilized egg to attach to it. So what happens to this lining if the egg isn't fertilized or if it doesn't attach? It breaks down, and what happens? Comes out, and the woman has her period, right. That's the day she wears her white pants. That's when she'll have her period. So the period is this lining sheds. Okay? Now, in 50% of the time that the egg is fertilized here, it doesn't implant. So that happens very, very often. 50% of the time that the egg is fertilized, it won't implant. And so the lining is shed, and the egg just slips right on out. It doesn't, she's not walking along on some boom, as this egg comes out. She won't be aware of it. Her period may be a little bit late, maybe a little bit heavy, but she probably won't know. Okay, so what kinds of questions do you have about this? Are you normally a quiet class, or are you just afraid to have a mistake for posterity being taped? Normally quiet? Okay, good. No? Okay, I won't get in trouble then.